Good morning and welcome to your Farm and Home Show. I'm Kristi and this morning we're visiting with Dr. Julie Marfell. She's an associate professor in the College of Nursing for the University of Kentucky. Good morning, Julie.
Good morning. Thank you for having me.
It's great to have you on the show. And Julie, today we are going to talk about how we can care for our skin and prevent skin damage.
Absolutely. It's so important, and I think we take our skin for granted many times, but skin cancer is the #1 form of cancer that is out there, and it's also very preventative. You know, it's important to be able to understand how to take care of your skin and the things to watch for. Cancer and aging is a problem with too much sun exposure. You can also have problems with your eyes if you don't wear sunglasses and have the right polarization on them. You can end up with some eye problems. Wrinkles, let's not talk about them, but yes, that does absolutely, is from sun exposure. You can get different patches on your skin. You can have some premature aging because of too much skin exposure, and also loose skin. And we all know that sunburns are not fun.
Yes.
So you really want to make the time to make sure that you're preventing those kinds of issues.
Now, Julie, what are some ways that we can self-examine our own skin?
Well, self-examination is one of the most important things you can do besides staying out of the sun and protecting yourself. And you want to make sure that you give yourself the time about once a month to really take a good look at your entire body. You can use mirrors. You can use the mirror that you have in the bathroom for your face. If you're lucky enough to have a full-length mirror that you can look at your back, so you can look at that way. Hand mirror, so you can get those spots that you don't necessarily look at otherwise.
Hard to reach.
Hard to reach, yes. Or if you have someone at your home that can help you with it, you know, it's a good idea to do that as well too. But you want to really be looking for things that have not been there in the past. Any type of freckle, any type of mole, any type of patch, just anything that looks out of the ordinary. And if you're doing it once a month, you're keeping pretty good track. We're really concerned about anything that is bigger than the eraser on a pencil, on like a regular #2 pencil, anything that has an irregular border, irregular color, anything that's bleeding, of course, and anything that's changing. So if you see something that's getting bigger, this is a good time to go to your primary care provider, but to have them take a look at it, to document it and see what they think, and they may send you on to dermatology. And again, going to dermatology may mean that they'll take it off. It may mean that there's something serious, but it also may just mean that you've got somebody else who's looked at it, said exactly what it is, documented it, and then you have some follow-up.
Now, Julie, let's talk about ways that we can prevent this damage before it happens.
Well, staying out of the sun is a good one, which we all love the sun to a certain extent. So making sure that you are not out between 10 and 4 is a big thing. Of course, that's when we all like to go to the beach. Wearing sunglasses, wearing long sleeves, any kind of a cover-up, applying that sunscreen on a regular basis, making sure that even though it says it's waterproof, that you put it on again after you've been in the pool or the lake or the ocean. And really just making sure that if you've got a baby under 6 months, no sun exposure whatsoever. Like I said, long sleeves, a hat, sunglasses, and just really taking the time to reapply makes a big difference.
So who is at risk of sun damage or skin cancer?
Anyone with light skin, lighter skin, fair-headed, red-headed, freckles, definitely that you're more at risk. Anyone that spends a lot of time outdoors, definitely is a risk factor for that. If you have a family history of skin cancer, you want to make note of that, and most times families are all over it because they've had the experience before. Sometimes your medicine can be a problem with sun. Always look at that. Always ask your provider, you know, does the sun, should I be concerned being out in the sun with that? Some antibiotics, some medicines that people take all the time. You have to be very careful. And also if you, for some reason, have a weakened immune system, it's a good idea to stay out of the sun because your sunburns can be worse.
All right, Julie, thank you so much for being with us today. So much great information.
Well, thank you for being here, and I hope it helps.
Yes. If you are watching and would like more information, be sure to contact your local extension office. Thanks for watching and have a great day.